May 28th, 2:30 public update. I'd like to turn it over to IDPH Director Dr. Ngozi Ezike for today's medical update.
Good afternoon. Thank you everyone for joining us. Let's jump right in. To date, 829,966 tests have been run in the state of Illinois, with 25,993 being reported in the last 24 hours. As of midnight, 3,649 individuals were hospitalized with COVID-19, and of those, 1,009 patients were in the ICU and 576 patients were on ventilators. Since yesterday, 1,527 new confirmed cases of COVID-19 were added to our Illinois total, which brings our total confirmed cases to 115,833. Yesterday, many of you may have noticed that we passed a grim milestone, if you will, of over 5,000 lives lost. We are at a total of 5,186. I would be remiss if I didn't offer my condolences and my sympathies to the families of all those who have lost loved ones associated with this virus. We are all truly sorry for your loss. Fortunately, an additional 104 individuals were reported to have lost their lives in the last 24 hours. So among those that have passed associated with COVID, almost 44% were those in long-term care facilities. And as we've known from the beginning, nursing homes and other congregate settings have always been at increased risk for outbreaks. On March 14th, we reported the first COVID-19 case in a long-term care facility in Illinois. IDPH was on site immediately to provide guidance on infection control practices, to ensure proper donning and doffing of PPE, and to assist with mass testing. This plan was put into action with the full support of Governor Pritzker, and we can't thank him enough for his encouragement and always wanting us to be proactive in all of our responses. I remember going to that first facility in DuPage County to support the team that consisted of the nursing home staff, as well as local health department staff, IDPH staff, and our infectious disease consultants. Of course, it's helpful to be there to see firsthand what's happening, and it was a great example of collaboration. We do understand that the burden of disease in facilities is high in these high-risk congregate care settings, but we're ensuring that swift action is being taken, and we know that facilities must immediately notify public health officials of any confirmed COVID-19 case, whether it's a staff or a resident. And this notification should also confirm that that specific facility is notifying all staff members, all residents, families, and their representatives by the end of that day. Our dedication to this population has never wavered. We continue to support long-term care facilities. We continue to promote the health and safety of everyone therein, the residents and the staff alike. As a state, we are definitely headed in the right direction. We have successfully met the metrics to advance into phase 3, but we must still proceed with caution. The risk of contracting the virus remains, so I implore that we continue to practice the use of face coverings, washing our hands, and be physically distant as much as possible with a minimum of 6 feet. Let's continue to do the hard work that is necessary to get us to the other side of this pandemic. And with that, I will summarize comments in Spanish. Buenas tardes y gracias por acompañarnos. Empiezo con el reporte médico para hoy. Reportó 25,993 pruebas hechas fueron reportadas en las últimas 24 horas. Hasta anoche se informó que 3,649 personas en Illinois fueron hospitalizadas con COVID-19. De ellos, 1,009 pacientes estaban en la unidad de cuidados intensivos y 576 pacientes estaban en ventiladores. Desde ayer, 527 personas han sido diagnosticadas con COVID-19 y ahora tenemos 115,833 casos totales confirmados aquí en Illinois. Ayer pasamos el número de 5,000 vidas perdidas por COVID-19. Seré negligente si no ofreciera mis condolencias y sinceras oraciones con las familias que han perdido a sus queridos a este virus. Realmente lamento tu pérdida. Desafortunadamente, se reporta 104 personas adicionales con COVID-19 que han perdido la vida, para un total de 5,186 muertes. Casi 45% de las personas con COVID-19 que murieron eran residentes en centros de atención a largo plazo. Hemos sabido desde el principio que los asilos de ancianos y las casas de congregación tenían un mayor riesgo de brotes. El 14 de marzo reportamos el primer caso de COVID-19 en un asilo de ancianos aquí en Illinois. IDPH estuvo en el sitio inmediatamente para enseñar las prácticas de control de infecciones, garantizar la colocación y puesto del equipo de protección personal y ayudar con las pruebas. Este plan se puso en acción con el apoyo del gobernador Pritzker. No puede agradecer lo suficiente para su ánimo a ser proactivo desde el principio. Yo recuerdo visitando este asilo de ancianos en el condado de DuPage para ver de primera mano lo que estaba sucediendo y lo que se necesitaba. Nuestra dedicación a esta población no ha cambiado y seguimos apoyando los asilos de ancianos por la salud y la seguridad de los residentes y trabajadores. Todavía no se acaba esta lucha. Tenemos que seguir adelante. Por favor, sigan cubriendo sus caras, lávense sus manos y estén físicamente distanciados. Ahora nos podemos. And with that, I will turn it over to Governor Pritzker.
Thank you very much, Dr. Ezike. And I want to begin today by bringing your attention to the charts that are here to my left, reflecting how each of Illinois' 4 regions has fared in meeting our Restore Illinois metrics. All of this data is updated every day for you to track for yourself on our IDPH website, dph.illinois.gov/restore. But I wanted to bring the May trends to your attention in recognition of the end of Phase 2 for all 4 regions of Restore Illinois. As you can see, each of the 4 regions has hit the 3 requirements for moving into the next phase. At or under a 20% positivity rate and increasing no more than 10 percentage points over a 14-day period, and no overall increase, so stability or a decrease, in hospital admissions for COVID-19-like illness for 28 days, and available surge capacity of at least 14% of ICU beds, medical and surgical beds, and ventilators. Starting tomorrow, all areas of the state are eligible to reopen in accordance with Restore Illinois Phase 3, which offers specific guidance on how things like outdoor dining, outdoor recreation, manufacturing, retail, personal care services, and offices can move forward with safety measures in place. All of that is available on the Department of Commerce and Economic Opportunity website, where you can find it at illinois.gov/business guidelines, illinois.gov/business guidelines. I want to let parents and kids know that we have provided guidance to day camps and youth sports to allow the return of those activities for children across the state. Summer activity is so important for overall health, and the doctors have given instructions for counselors and coaches so that summer programs can be restored with safety measures. Later today, We will also be posting recommendations for houses of worship, providing more guidance for houses of worship in Phase 3. Having received many plans and ideas from responsible faith leaders, IDPH has reviewed many detailed proposals and has provided guidance, not mandatory restrictions, for all faith leaders to use in their efforts to ensure the health and safety of their congregants. This includes suggestions on capacity limits, new cleaning protocols, indoor gatherings of 10 persons or less, a reduction of activities like sharing food, and the safe conduct of outdoor congregating. The safest options remain remote and drive-in services, but for those that want to conduct in-person activities, IDPH is offering best practices. Additionally, with Phase 3, horse racing will be returning to Illinois tracks, boosting the industry in a key season, especially for thoroughbred and harness racing. The Department of Agriculture has worked with the IDPH, with the Illinois Racing Board, and industry leaders to develop guidelines for racing, allowing those whose livelihoods depend on these races to get back to work, and allowing spectators to watch from home and place wagers online and over the phone. And while it's still at least a few weeks off, I want to affirm that the 3 metrics that have brought us from Phase 2 to Phase 3 will be the same as those that will move us into Phase 4. Just as this 28-day period of tracking started when we moved from Phase 1 to Phase 2 on May 1st, our next health metrics calendar will restart tomorrow and run for the same period, meaning that regions that meet the metrics could move into Phase 4 possibly as early as Friday, June 26th. That's the earliest possible date, and we will be watching the metrics closely in hopes that we will move forward expeditiously. But our goal is, and always has been, to keep people safe from this coronavirus while we restore more of our normal activities. So it's important that we remain careful about continuing to wear face coverings, washing hands, maintain 6 feet of distance, wiping down surfaces, using hand sanitizer, and other mitigations. Let's not move backward, but instead, let's move forward together. Because Restore Illinois is a plan that has 4 regions, Northeast, North Central, Central, and Southern, we will restart our tracking of the data for each region beginning Friday. As always, individual townships, counties, municipalities can choose to operate on a stricter schedule and with stricter metrics. With that, I'd like to talk today about long-term care facilities, which have been at the center of our COVID-19 response since day one, and which will continue to be a central focus of our work, especially as we safely reopen sectors of our economy. The overwhelming majority of long-term care facilities in Illinois are privately run. In response to the COVID-19 crisis, some of those facilities have acted proactively, some only reactively. CDC guidelines have provided those facilities with the roadmap for managing infection control through this crisis. But at the state level, we've gone beyond CDC guidelines to provide free testing of residents and staff by our IDPH nurses, consistent communication of best practices, and individual facility consultations with infection control experts. And we have delivered PPE to every nursing home in the state and to all counties with long-term care facilities. Of our roughly 1,100 long-term care facilities that care for elderly Illinoisans, over 900 have been connected with directly and in person by the IDPH Office of Healthcare Regulation, IDPH consultants and coordinators, IDPH's teams of nurses, or members of the Illinois National Guard. That includes visits to provide help with testing or staff PPE training or support for existing staff to administer tests or a whole host of other supports. Our IDPH consultants and coordinators interact regularly with the statewide network of 97 local health departments, which remain the front line of communication and support for private long-term care facilities in all elements of our COVID-19 response. Our state's response teams going into nursing homes have evolved over the course of this pandemic, so I want to bring you all up to date. We now have two groups of nurses fanning out to long-term care facilities around the state. One group of 200 IDPH nurses who are doing focused COVID-19 infectious disease control surveys to monitor compliance, and who can also conduct swab testing, train existing staff to take specimens themselves, and review and improve each facility's PPE use and hygiene practices. And a second group of 100 contract nurses, which we doubled at the end of April, who are also monitoring for infection prevention and control, but also providing additional testing assistance. We now have 10 teams averaging visits to 2 homes a day each, potentially as many as 140 a week across the board. Those teams are ensuring best practices to keep residents safe and helping test residents and staff for facilities that have requested assistance when they cannot manage it themselves. Some long-term care facilities opt out of the free assistance of IDPH's response teams, sometimes because they choose to take their own specimens using IDPH swabs, or because they choose to work with their county or city health department instead. Others work with their local hospitals and health centers to source and conduct tests. To date, we've sent about 45,000 testing kits out in 200 shipments, up from 18,000 swabs to 68 facilities back in late April. Still others have declined the free visits and even the free testing supplies from IDPH entirely. As I've explained, these are largely private entities, and even as we work to ramp up regular testing of all our long-term care residents and staff, my administration has received some pushback from owners and industry representatives, making it difficult to secure compliance across the board. As a reminder, from the beginning of this crisis, we've put our long-term care facilities, and especially our nursing homes, among the highest priorities of our COVID-19 response. In the earliest days of March, we implemented strict protocols at our state-run veterans homes and congregate care facilities and provided similar guidance to the hundreds of privately owned facilities statewide. And at our March 5th briefing of the General Assembly, we offered copies of those recommendations to all state legislators to get their help in instilling a sense of urgency in long-term care facilities in every corner of the state. Many facilities have been great partners, and they should be applauded. But long-term care residents are some of our most vulnerable Illinoisans. That's why strong compliance from many isn't good enough. To counteract any heel-dragging at any privately held nursing homes, the Illinois Department of Public Health is today filing a rulemaking requiring each facility to develop its own individualized testing plan and document an established relationship with a testing lab, whether it's a commercial lab, a local hospital lab, or our state labs. This new rule will require nursing homes to conduct testing when experiencing an outbreak, when an outbreak is suspected, periodic testing even when there is no sign of an outbreak, in line with new federal guidance issued this week, or when directed by IDPH or their local health department to do testing. The rule also mandates compliance with infection control recommendations at large. Test results should be used to identify asymptomatic cases, to confirm infection in symptomatic cases, to evaluate quality indicators, to follow up on infection control programs, and to support decision-making. To be clear, this rule doesn't deviate from our existing priorities, but it gives IDPH, a regulatory agency, additional teeth in securing buy-in from these private entities. Administrators who decline to provide a testing plan will be found in violation of the rule. The challenge of protecting elderly Illinoisans who live in congregate settings, many of whom have underlying conditions, is evident in the heartbreaking percentage of illness and death that have been seen nationally in LTC facilities. COVID-19 is unrelenting, and it has visited its worst effects on older Americans. But our state will continue to use every resource at our disposal and the collective medical experience from across the nation to protect our seniors throughout this crisis. And with that, I'm happy to take questions from members of the media. Tina?
Governor, what is the punishment there if these nursing homes do not abide by this rule?
A typical IDPH regulates nursing homes, so they have the ability to issue violations as they do with other regulatory matters.
And that would be like a licensing thing, or could it include a fine? Or?
It's typically a fine, yeah, but it can involve their licensing too.
Okay. Governor, you said, I think on Sunday, the legislature did not pass that measure that you wanted to punish businesses if they didn't follow the executive stay-at-home order. Mm-hmm. And I'm wondering, are you planning to file any other sort of rule? I know we're going into the reopening phase, but what will happen? Do you want any sort of other emergency rule in place should these businesses not abide by your plan?
Well, we're continuing to look at that, but I will say that, what we've been left with because of the inaction by the legislature is the removal of licenses, which is something we didn't want to have to pursue.
So as of right now, if they don't follow, they can have their licenses removed?
They could.
Okay. Regarding some other legislation that failed over the weekend, there was a FOIA bill along with a bunch of other things in this one bill. Your administration said you did not support that. So can you tell reporters in the state what it will look like for the FOIA process right now? Will we have delays for X amount of weeks, and what is the reason for that?
Well, I can't speak to all the other levels of government and how they will respond. I mean, we know what the FOIA laws say today. As I've said from the beginning, in the midst of the pandemic and in this emergency, it's taken us a little longer to be responsive, but we are responding to FOIAs as fast as we can. But again, given that some of the staff are at home, some have been, ill or otherwise unable to respond, we're just asking a little bit of forbearance for small periods of time, but we are responding to FOIAs as requested.
And that's notifying people that there are delays in every instance?
That there will,
There will be delays, your department or your administration?
I think I've made that, I've made that clear, and I think we've notified people as much as we can and are required to, but it's our intention to fulfill the FOIA requests.
Okay. A question for Dr. Ezike. I know we've talked about nursing homes a lot over the past 2 months. Is there any sort of metric of nursing home residents that have died of unrelated to COVID, maybe from other illnesses that kind of were exacerbated by maybe lack of visitors or something like that?
Yeah. So again, when you're dealing with this population that obviously has the major risk factor of being elderly and has the additional risk factors of having multiple comorbidities, it's really hard. I don't think there are any individuals in that group that don't have 1, 2, 3, multiple of those high-risk factors. So I think all of those fatalities, as unfortunate as they are, would absolutely be COVID deaths. In terms of, did someone die of a broken heart? I don't know how to assess that, so I don't really think there's a metric that I could give that could really get to that.
Yeah, I just mean, is that being counted as it's a separate subset of people who have died in nursing homes during this time of unrelated illnesses?
I don't think there are any that would satisfy that criteria, where they had no other medical problem, that they were completely healthy, and that this infection was just a coincidence, and that there was not something related to the COVID. I think all every one of these deaths had a direct tie to the COVID infection, and that spurred on. Again, they had other conditions, definitely, but this COVID absolutely had some kind of contributory role.
I have a question for the governor from Kelly Bauer from Block Club Chicago. A Chicago church has asked the Supreme Court to overrule your stay-at-home order. Do you have any concerns about this action or the fact that churches continue to hold services with millionaires like Willie Wilson paying their fines?
Well, multiple federal judges have reviewed and upheld the approach that we've taken with our executive orders with regard to houses of worship. So, these courts have recognized that there's a public health crisis that's ongoing and the need to take steps to protect public health, as we have, including as related to religious services. I think we all are aware of circumstances in which there have been infections that have been spread during religious services that were held with many people packed together. The Attorney General's office will be filing a response as is required in the case that you're referencing.
Okay. How will you protect and provide relief to workers who don't feel safe returning to work next week in Phase 3?
Well, the first thing we're doing is imploring and providing guidance to employers that the employees should look at too. All of that is available again on our DCEO website. And employees that find that employers are not following that guidance should report that their employers are not following it. And of course, that should be reported either to the Attorney General's Workplace Enforcement Office or the Department of Labor, both of which have the ability to enforce it.
But for employees who just might not feel safe going to an office yet next week, what do you advise those? I know you said private businesses should use their discretion.
Private businesses need to use their discretion. In fact, especially when it comes to the most vulnerable, people who have pre-existing conditions, employees should make those, to the extent they are able to, make those known to their employers so that their forbearance can be given to them for that. But, obviously what we're looking for here is a common decency that should come from employers, and then, of course, we'll rely on enforcement wherever we need to.
This is from Greg Hines from Cranes. Some other states, including some with Democratic governors, are making deep budget cuts rather than counting on federal help. Why are you plotting a different course? Are you prepared to make more cuts in this budget if the only help you get is Federal Reserve loans that have to be repaid?
Yep. So, as I've said all along, this is not a time for governments, state governments particularly, to be cutting services, especially a government like ours where agencies have been hollowed out over a number of years. As you saw, I've attempted heartily to try to build back up some of those agencies, but I've known, and I think everybody else has known, it would be a multi-year process to do that because it took many years to slash and burn those agencies. So, look, I also recognize that if the federal government does not step up to the plate, that we're going to have massive cuts. Everybody understands that, and we will have to revisit this, right? But the legislature will meet for sure in November for a veto session, and perhaps sometime in between, and we'll be evaluating whether or not the federal government did do what I think everybody hopes and expects that they will do. Again, we're not in a unique position. What other states have done certainly is some states have put forward cuts that they might put into place if they're unable to get support from the federal government. What we've said is, look, we'll be working very hard to do that, but our sincere hope is that making cuts now would be so bad for working families and for people who've been out of work now as a result of COVID-19, that what we'd like to do is maintain state government as it is, again, still hollowed out to some degree, as it has been over the years, and then, we'll manage through as the next month or so reveals whether the federal government will step up.
This question's from Jim Leach from WMAY Radio. The Restore Illinois website today says the central region is not meeting one specific metric for Phase 3 reopening, which is the hospital admission change. Is that one metric alone enough to delay moving to a new phase? Does the state have flexibility in determining how to use those metrics?
Actually, I saw the updated numbers from today's numbers. When those got added in, I think in the last hour, you'll find that, as it happens, the central region is now meeting all those requirements. But even if it had been the number from yesterday, it's very, again, the idea here is stable. And, when you talk about 2%, that's stable.
Good afternoon, everyone, and welcome. As I said yesterday, our Phase 1 economic reopening order expires this Sunday on May the 31st. And we are very pleased at how well Phase 1 has gone so far. Businesses, communities, and Missourians across the state have done a great job of implementing health and safety measures. And we continue to be encouraged by data across the state. With that said, today I'm extending the Phase 1 order through Monday, June the 15th. Extending Phase 1 through June the 15th aligns us with our executive orders as well as the state of emergency in Missouri. Additionally, some communities across the state are further along than others when it comes to reopening and economic recovery. Extending the order will give these communities more time to prepare and align with us at the state level as we continue working towards Phase 2. I want to assure you that our efforts are showing positive results. We are still in a good place with all 4 of our recovery pillars: testing, PPE, hospital capacity, and data. We are extending Phase 1 not because Missouri has taken a step back, but because we want to make sure we are fully prepared for Phase 2. Nothing about Phase 1 has changed. As long as social distancing and other necessary health and safety measures are implemented, businesses can still be open. Events such as graduations, weddings, county fairs, summer schools, and camps can still take place. There are currently no limitations on social gatherings as long as precautions are taken and 6 feet of distance can be maintained. The bottom line is that we must continue to social distance, use common sense, and make responsible decisions to protect ourselves and others. As long as we do this, we will continue the progress we have made with our recovery plan. Speaking of economic recovery, we are excited to announce another business expansion in the state of Missouri. Today, Tooling Tech Group, the second largest tooling provider in the United States, announced a $7.5 million investment to expand its operation in Washington, Missouri by 21,000 square feet. Since 1983, Tooling Tech Group has been a dedicated partner in the Washington community, and we are excited to hear about its expansion project. It is encouraging to know that even in the middle of COVID-19, companies are still investing in our communities. Announcements like these give us hope and confidence as we move forward on the path to economic recovery. I'm thankful for that company's expanding at a time like this, and as I said a couple of days ago, when you realize where we were in January, that things were going so well in our state and we had opportunities for businesses to come here, company expansions, we knew that opportunity was still there. We just had to deal with the virus, and I think now we're starting to see proof that those companies are still interested in Missouri, still the demand's out there. So again, I want to say I hope our recovery process that we go through is going to be on a much faster pace than a normal recession recovery, and I'm still confident that we'll move forward in that in a third and fourth quarter. On the testing front, we will continue to make good progress with our testing plan. From last Wednesday, May the 20th, to yesterday, May the 27th, we have exceeded our testing goal of both sentinel and community testing. For sentinel testing, 6,466 tests were planned from the 20th to the 27th, and 8,127 tests were actually done. The community sampling, 2,550 tests were planned, and as of today, 2,970 were done. We have come very close to our goal of boxed-in testing, completing approximately 4,539 tests in the past week out of a planned 4,670. In addition to our efforts at the state level, CVS Health announced today it will be opening 22 drive-through COVID-19 testing sites at selected CVS pharmacies across Missouri. Self-swab tests will be available at these new sites for individuals who meet CDC criteria and state and age guidelines. These drive-in testing sites will be a huge help with our continuing efforts to increase testing in Missouri. We are grateful for CVS' commitment to slowing the spread and keeping our citizens healthy and safe. And to wrap things up for this week, tomorrow I'll be on the road. We'll be in St. Louis and Springfield tomorrow. I'll be joining County Executive Sam Page for this Friday's briefing in St. Louis County, and we'll also be delivering some Mass to churches in the area in the St. Louis region. Our next briefing here in the governor's office will be on Monday. Over the weekend, I again want to remind everyone to please be safe, smart, and responsible. We have said all along the social distancing will be a part of our daily lives for some time. This was true a month ago, and it is true now. We have made tremendous progress, and I am confident in the direction we are headed, but we must keep up our efforts. I also want to give a shout out before I finish up to the Beef Month in May for our cattle farmers that were out there. There's been a lot of issues behind the scenes with COVID-19 on the food processing plants that have been in the news with COVID-19 and the testing. But I also want to say this time's been very difficult for our farmers across the state of Missouri when it comes to beef production, when it comes to pork production. Those two industries have been hit hard. They continue to be hit hard in the processing side of it and where they can be able to sell their product. And for most that don't realize what it takes to process something from the local areas, the local farms, even to get livestock processed now, you're probably almost in some instances a year away from getting that done. And we've never seen things moved out because of the demand of that and why we're so far behind in the state. And again, that kind of goes to the national arena where we've had some issues there that I know the federal congressional delegation is looking into that. But anyhow, I want to say to my fellow farmers out there, congratulations on Beef Month. Keep up the good work. We've been through tough times before, and we'll get through this one. So, again, thanks everybody for being here today. Dr. Williams is also here to be able to answer questions. Dr. Williams, you got a few words you want to say before we get started? Or you want to go to questions? Come on up, Dr. Williams, then we'll get to questions.
Just to reiterate, incredibly appreciative to all those Missourians that were allowed us to do 5,500 tests yesterday throughout Missouri, and all the people who performed those tests, all those people who had the test in all three areas, our community sampling and our Sentinel and our boxed in. It is incredibly helpful to us, and we are finding people who are positive who wouldn't have known they were positive. If we hadn't been doing that testing, and whether that's in a long-term care facility or whether that's in community sampling or one of our state facilities, we think that makes a difference. We really do. And so we're incredibly appreciative of that. Incredibly appreciative of CVS. As you know, 22 sites, predominantly in Kansas City area and St. Louis and Springfield, picked by CVS and the federal government to make testing available. It's drive-in. You have to get an appointment. You do the test yourself. But that's 1,000 more tests a day, which is just incredibly helpful. So we're thankful to them. And Kelly, I'm happy to answer any questions.
Okay, any questions for Dr. Williams? Hi, Dr. Williams. With the community sampling initiative that you've been doing, do you have demographic data on that? Do you have an idea of who's coming out to do that community sampling and whether it overlaps with the more at-risk demographics like the Black and Latinx communities?
Yeah, for the community sampling, it's all comers. It's just people who want to be tested. It's not a true prevalence study, which we're talking about doing with the University of Missouri, in which we do take that into account so that we can extrapolate from that. So for this, it's really just to offer to those people who want to be tested the opportunity to be tested, both for their benefit, which we've exceeded our capacity. Where we've gone, we've had more people who want to be tested who want to be tested. But to your point, it doesn't get us to that granularity, but we will do that. Thank you.
And just a quick follow-up. On May 5th, you put out a whole bunch of information on the website, including some modeling and some predictive stuff. Is there plans to do that sort of data dump again, or was that a one-off?
No, we plan to just keep updating that as we go, and we do that daily. And so, I think the next big dashboard you'll see is economically. We've really gotten our dashboard very robust for health, and I think the plan is to also do the same thing for economic recovery.
Okay.
Thank you.
Yeah, sorry. Hi. You mentioned the antigen testing yesterday. Is there any update on where that's being used?
No, I'm sorry. Not as yet. We just got word that that's being done, and we're in the process of making that reportable as our other testing, and we'll put that on the website as well. And so that is all being done as we speak. Just got word of that yesterday. Thank y'all. Oh, I'm sorry.
I'm hiding back here, I'm sorry. The governor was talking about beef packing plants and the issues they've been dealing with. I'm from St. Joseph, and you're well familiar with what's happened at Triumph Foods. In the last couple of days, I've been talking with employees who have previously tested negative who are now positive, and even those who have been brought to the emergency room. We also know that there are 500 or 600 employees there who were never tested. And so if you go off the percentages there, maybe 100 more perhaps positive. What do you do now with a plant like this that is now getting new positives re-entered into the system?
Well, thank you for the question, because to your point, this is not a one-off. This is an ongoing process. And so we were just out at the SEOC meeting just about that, is what will be the rhythmicity of going into Triumph and our other meatpacking plants around the state. We have about, I think, 12 or 13, and doing sentinel testing. And so that would include testing people who are symptomatic, but also picking a certain percentage and in a rolling fashion, just continuously to check them. And at some point, we will probably move that into antibody testing. But I just left a meeting with about 100 people that are looking just at that, and we'll probably be rolling that out next week. And Triumph has been very persistent in wanting to know what that would look like. And so I think we can tell you that next week, how often we'll be doing that testing.
If I could sneak another question in, another Northwest Missouri question. You've talked about testing in nursing homes and other areas for the boxed-in strategy, yes. I guess. Mm-hmm. We are understanding of a nursing home in Gentry County that just had its first death and has numerous cases within the facility. When do you make the decision to go somewhere like there, or have you made that decision, or being aware of it?
I'm not. I just left that, and I know we added 10 more since the original 51 in the last weekend, and that may be one of them. If it's not, again, they are required now by rule to report to us within 24 hours if they have one patient or one staff, and then we go in and work with the local health director.
So through the health department there, yes. You would go in for mass testing of this nursing home?
Yes, anywhere in Missouri, if we have one patient who's positive or one patient or one staff member who's positive, we now go in and work with the local health department and the long-term care facility to recommend our boxed-in strategy. So I'll check on Gentry County when I leave here. I suspect that's one of the ones we added, but if not, we will add them.
If this is a nursing home or another business, how are you made aware of the location? Is it the company that comes forward to you, or is it the health department?
Well, again, thank you for the question. 2 weeks ago, we changed that rule so that the institution, the long-term care facility, or a jail, or a congregate living facility is required by law to report to us within 24 hours. Before, it was the provider. It would have been the doctor who did the test. But now, as of 2 weeks ago, we require the facility to let us know, and that triggers a very robust response The governor has mentioned this numerous times, is that when we look back at our mortality and our morbidity, sadly, so much of it is concentrated in our long-term care facilities. Now, because we've so purposely worked to build up our testing capacity, and we'll now be to 10,000 tests a day now that CVS has come up on board, we're going to use that to get in there as quick as we can and box it in.
Appreciate it. Thank you.
You're welcome. Thank you.
Thank you. Let me just make a comment. I know whoever was up there from Northwest, I don't know who's asking those questions, but one thing we want to do, we want to do as much testing as possible. So we want to provide those services up there. I think it's also important to remember when all the counties were distributed money across the state of their initial round of the CARES Act, that money can all be used on the local level for testing also. So we're going to be encouraging that. You'll see Director Dixon in here next week, probably speaking a little bit on the economy and really figuring out what we can do on the business sector on the testing side also. But we want to encourage those local levels, that money they got, to be able to utilize that for testing as we move forward. So questions?
Just on keeping the state in phase one of this, you said that there are some communities that aren't as far along as some others. What are those communities, and really what would you like to see those communities do, and what kind of level would you like to see them get to before we move into phase two?
Yeah, I think every day, and you got to be looking at the data that we look at. Like just we'll just go in the briefing, you heard about a nursing home in a different part of the state that we haven't done before. So we need to really keep an eye on those things like that. You still have the St. Louis region, the Kansas City region, that's not as far along as a lot of the other parts of the state. Springfield, for example, Columbia's did really well, but they're ahead of those two on that. So one of the things as we've been moving forward to this, I've been talking to the mayors, county executives, county commissioners across the state that we're talking to them, trying to figure out how we can kind of narrow our questions down, or narrow the order down to where we're all on the same page. So with the average Missourian out there, when they go somewhere, they can feel like they can do about whatever they need to do wherever they go, and they're not trying to figure out whose guidelines are whose. So that's another thing we're trying to get in line to open the state up more. But look, we got to continue to open the state up as we move forward.
And a quick follow-up on that, did the videos and pictures from the lake this weekend have any bearing on your decision to keep the state in phase one?
No, it really didn't. We were pretty well along the way on making this decision. Again, I think Memorial Day weekend for the whole was our first major weekend. We want to see how all that comes out. We want to see how everybody was. But again, the thing at the Lake of the Ozarks is a very, very, very small sample of what was going on in the state. And for the most part, people were doing their part, and I think they're going to continue to do that. I'm confident of that.
Hi, Governor. Do you have a sense yet of what phase two will look like?
Well, it's going to be more open. I mean, we're going to be finding out to the point where at some point we got to get out of the phases, we got to get out of the orders, and we got to get people back to work. That's the key to moving forward and be able to do it safely. So I think that's one of the things we got to do. But we got to start preparing ourselves for that. We got to start preparing ourselves that we're going to have to live without an order, and nobody's going to have to tell everybody to do social distancing. We're going to have to take it upon ourselves to do that and kind of reiterate that from time to time. But, in the very near future, I hope the state is open back up for business at all angles of that. I hope there's sports back there. We're just going to have to be cautious of how we conduct ourselves. But we're just going to move forward at a time. So June the 15th, we'll make another decision.
And separately, just given the recent history of our state here, do you have any thoughts on the death of George Floyd and the violence that was seen in Minneapolis last night?
Look, I was in law enforcement for a long time, and you see what's going on in other cities. You never want to see that. I don't. And I think I've always held myself to a higher standard, whether I was in law enforcement, whether I was in the military, whether I've been a legislator, whether I'm the governor now. When you get in those positions, you got to be held to a pretty high standard to how you conduct yourself. And look, there's times like that what I know from the outside looking in probably wasn't the best of circumstances, and people have to be held accountable for that. But again, I want to be really careful where I judge somebody because of just what I've seen on TV, because I don't know what the facts were and everything. But, as a normal person, it didn't look too good to what happened there. And by all means, law enforcement, I prided myself in that forever. Your job is to take care of people, not to hurt people.
Governor, you mentioned a couple of days ago that it's local health departments' responsibility to enforce social distancing orders. The Springfield News Leader has reported that counties in the Lake of the Ozarks area, are saying that it's up to the state health department to enforce those orders. So we've gotten an almost impasse where no one is enforcing the order. How do you propose to break through that impasse or a resolution?
It is what it is. You know, the local health departments, for example, shuts down restaurants when they're not doing something right, when they're not clean, when it's not healthy. The state don't come in and do that. They do that. That's their job to do that. You know, look, I've been a supporter of local control ever since the beginning that I've been here as governor. You know, I'm telling you, the local control sometimes needs to take the responsibility, good and bad. And that's the way it is. And I kind of said that the other day. I don't like the federal government in here mandating what I do as governor of the state of Missouri. And that's why people get elected on local levels. We've said again, the health department, we issue guidelines for the local health departments. The avenue, the local health departments of the statute, I don't know what statute number is, but they would go to court. They would file with the court, with the judge. A judge would then do an order, and then you would enact that order, whether that be through whatever means he decides to use, you know, whether that's pulling a business license, whether that's like anything else. You know, COVID-19 has caught a lot of attention, but at the end of the day, the rules are in place that were in place before that, and they currently still are. You know, just because COVID-19 doesn't change it.
Governor, you have the state health department does have the ability to enforce the social distancing order according to the order. Is it a philosophical difference as to when they should use those enforcement abilities?
I will answer that like I did the other day. You can make an order that we keep 6 foot distancing. There's nobody going to be out there from the state level monitoring who's 6 foot away from each other and who's not. We're not going to do that. It's a recommendation for people to follow is what it is. But again, I'm not going to send some sort of police action out there to enforce whether somebody's 6 foot apart or whether they're not. I think that's a dangerous road to go down when government has that kind of authority over individuals anyhow.
Going into Medicaid expansion, the hospital associations worked with the state in its response to COVID-19. They also supported the Medicaid expansion ballot initiative, and they said that, and other researchers have also backed this up, that Medicaid expansion helps hospitals stay open. It brings in more revenue. States with expansion have more rural hospitals stay open than states that haven't. Do you find that argument credible, or do you think that the costs outweigh the benefits?
You know, there's no doubt that the expanding is probably it's to the advantage of the hospitals. There's no doubt about that because they're going to be seeing the patients and they're going to be receiving the funding from that. The end of the day is what is the taxpayer willing to pay for? Because when you expand Medicaid, if you put, for example, I think one of the theories I said, and again was about 200,000 people to add to the rolls, you know, it's going to cost a lot of money to be able to do that. So, I mean, first of all, I want to be clear. I appreciate what the hospitals do every day, and I appreciate what they did in COVID-19. You know, but I will say this: that they really have a reason to be involved in the passage of Medicaid due to financial reasons. And I think I don't think that's any secret. But I think you also got to look at the whole picture when you decide whether you're for Medicaid or whether you're not, and what that really means for the state and what it means for the taxpayers of the state.
And just a quick follow-up on that. So right now, as the status quo goes, the state covers around 35% for people who are covered with Medicaid when they go and use their coverage. Under expansion, it would be 10%, I believe, and the federal government would pick up the rest. So how does that fit into the argument about it costing more?
Well, first of all, you can't take the 65% that you're talking about and shift that over to the 90%. That's one of the little misleading things they talk about. Kind of what you just said right there. You kind of people want to say, okay, well, it's only going to be you're going to get 90% where it was 65. You can't legally take those people that are at 65, 35 and move them up to the 90% category. You can't do that. That will be for the new people coming on in the program. And the federal law won't let you do that. So that point needs to be pretty clear. That's why, you know, it's going to cost more money.
Governor Parson, how confident are you in the state's healthcare system to keep up with any new cases, any new spikes in cases of COVID-19 as you continue to reopen the state more fully?
Yeah, extremely confident in it. again, it's just incredible what the healthcare has done in this state of Missouri during this time. I think right now, the last numbers I've seen, we're probably somewhere around 600 in hospitalization right now that are in there, less than 100, I believe, on ventilators. So all that's good news compared to where we were. And I think we've got the capacity for over 2,000 ventilators. We got some in stock. We're much more prepared now than we was. But I don't think, I hope, we're not going to see any kind of numbers like we first seen when it took off and we wasn't prepared for it. We're much better prepared for that. But the hospitals are in good shape. We know we still have a temporary hospital out there. We know we can go to different parts of the state now, and within 10 to 11 days, we can put up a full-blown hospital. So that's a little comfort to know that can be done. And again, my hat's off to the hospitals and the healthcare across this state for what they did during that time, and you can see how quick they can move and how quick we can do things we have to. But again, I think we're well prepared for that if it happens, and I think we're all watching that daily.
Hi, Governor. In a legal filing, this has been reported that lawyers for the Cedar County Commission and the Cooper County Public Health Center said that your social distancing order contradicts the state's interpretation of a measure that you signed in 2019 that bars counties from enacting health rules on agricultural production. So just wanting to see if you have any comment on that or stand by that.
I don't have any idea exactly what you're talking about there. I think you're going back to the CAFO deal back in 2019. Is that what they were talking about, those two counties? Yeah. And I think that's a totally different argument what we're talking about today. You know, you're talking about CAFOs back then. We're talking about health care for everybody today. You know, an order's an order. We did an order, on that. So I'm not sure that's a very fair comparison of what we're talking about today.
Governor, there's going to be municipal and local elections all over the state June 2nd. Do you plan on voting in the local elections, and are you going to go in person?
I don't know whether I'll go in person or absentee yet. I'm not for sure, but I'll plan on voting in it, if at all possible, if I can.
Okay. And is there any message that you have for Missourians who are contemplating going to vote in person on Tuesday?
Yeah, I hope they get out and I hope they vote. That's one of the most important things we can all do is to vote. I think most of your elected officials that I know of across the state, I think they're well prepared to know the situation, and I think they're going to make that as safe as anywhere else you go in the state of Missouri, whether it's some other business or that. But I'm confident the counties and the local elected officials understand what we're up against here, and they're going to be above all means, they're going to be making sure it's safe that's there. I think Secretary of State was out a week or two ago, to almost every polling place in the state, making sure they had equipment there, making sure they were prepared when this vote comes. So, I hope people feel safe, but to go out and vote. But if they don't, the number one thing is their safety should be number one. So if they don't, then don't go out and vote. I don't know that I've ever heard myself say that, but if you didn't feel safe, then I wouldn't do that. So, but I hope people feel safe enough to go out and vote. Those elections are important. They're important for what happens down the road, as we all see right now, what elected officials on the local level are doing and how important it is to make sure you got the right people in the right place.
Just one quick little follow-up. You mentioned that you can't transfer over current Medicaid recipients to that 90% rate from the 65% rate. If more people are going to be qualifying for Medicaid because of the job losses that we've seen and the loss of income, isn't it preferable to have that 90% rate rather than the 65% rate if you're adding people to the rolls with or without expansion?
If you're at it, well, you'd want it to be as high as you could if you're going to expand it. Sure, if you're going to get 90% for them, if you expand it, you sure want that if you can get it, yeah. I don't think there's any doubt about that. So if it gets implemented, for those, it's good. But, the whole point of it is, and there are going to be a lot of people, pros and cons on this, but, I just think it's important for people to understand really what the expansion is and really what it is Missouri does, to know all the details in that, and then make a decision. But people will figure that out. There'll be a lot of propaganda on both sides trying to influence people how they vote on that issue. But at the end of the day, this is what I do know. I don't know of hardly any program that I could name to you, and I've seen a lot of them, that when government expands, it gets less expensive. That's going to be a hard argument for me to ever believe that anytime you expand government, things are going to get cheaper or we're going to save money. I haven't seen that happen. Government's not very good at doing that either. I do know that.
Thank you, Governor. One more question regarding Triumph Foods. I apologize, but there are employees who had tested negative who are afraid of going to work, and some of them have come up positive. They have organized a Change.org petition with 5,000 signatures on it now. We know the presidential declaration. We know the importance of the meat to the food supply. Yeah. What do you tell these employees who are afraid to go to work every day?
One, I think we need to do as much as we can to educate the employee to know what the risks are and how we can test for that. I think you brought that up earlier with Dr. Randall's. If testing is what makes everybody feel safer, is why we're doing it in a much larger number, that's what we want to do. We want them employees to do everything we can that they feel safe when they go to work. And whether that's the PPE gear they might have, whether that's the testing that we might have, or whatever we can do as far as distancing goes, working with a company or something. But at the end of the day, I don't think any of us want any employee to go to work in an unsafe condition. So I think it's the employer's job, along with ours, to make sure that it's safe as we can make it. But people's got to go back to work. I don't know that you can just necessarily say, I want to stay home without some reasonings behind it and totally understanding what the risks are. I think it's a job on us to make sure they understand that. And then they have to make decisions whether to go to work or not like everybody else.
Thank you.
All right, thanks everybody.